Alan Favors, who is here on site this morning. He'll be substituting for Chief Hatcher, and Alan will be joining us via Zoom in just a minute as soon as our IT gets him connected. Chief Lisa Collins, Wassamasaw.
I am here.
Good morning.
Good morning.
Chief Mingo Tanner of the Chickasaw. Don't see. Okay. Chief Lamar Nelson, I do see.
Yep, I'm here.
Good morning. Okay. Chief Steve Davis of the Natchez. And Chief Elizabeth Vereen of the PD. Those are our voting members. Now, non-voting, of course, Dr. DaCosta, like I said, she'll be joining us shortly. Myself, obviously, I'm present. Dr. Leader, will be joining us soon. Apparently, he will be, he was on his way over here thinking it was in person, but we told him it was on Zoom. So he's back at USC and he'll be joining us via Zoom as well. Chief Bill Harris, Catawba, don't see present. And then Chief Michelle Mitchum, Pine Hill. And those are our non-voting members this morning. So we have roll call completed. And this morning's agenda, I think everyone has a copy of it. Charisse can put it up in there on the screen in case you do not have a agenda. There we go. So this morning we have, I believe, Cheryl, are you with us this morning? I didn't see you on the Vice Chief Cheryl Wakama.
Yes, I'm here.
Okay, well, I hope so. You're one of our presenters, right?
Excuse me?
One of our presenters, right? I was hoping you did.
Yes.
Okay.
Yes, I am.
Good. Well, this morning we have our usual, I'm going to give my programmatic update, which won't take very long. And then we have allotted 30 minutes each to two presenters. One is, of course, now if I'm maybe pronouncing your name wrong, please correct me. Jan or John Narod from, is that correct?
Nehrud, that's pretty close.
Nehrud, okay.
That's a lot better than some of the pronunciations, so we'll take that.
Okay, thank you. He is from the South Carolina Department of Alcohol and Other Drug Abuse Services, also known as DAODAS. And I'll reintroduce him a little in just a few minutes. And then, of course, we have Vice Chief Cheryl Hale from the Waccamaw this morning. She's our second speaker who will come after Nehrud. And then we have some other updates and then the time for public comments, which I believe Nina was going to join us this morning to give us a very brief update. I don't know. Nina, are you on the call already?
I am on the call. Thank you.
Oh, good, good. At the very end to give us a reparations update at the very end of the meeting this morning, I guess, to add on to what Dr. Leader may or may not have to share with us as well. So let me go ahead and get started and give you guys a brief programmatic update so we don't take time away from our speakers this morning. I'll make this very brief. As part of our American Indian Workforce Development Initiative, what I've been doing
is Cheryl up there. Okay.
Oh, I'm sorry. Alan has just joined us. So that's Alan from Waccamaw. I've been doing giving what I call cultural awareness presentations to workforce development boards around the state as part of the South Carolina Department of Employment and Workforce. And we have an MOU with them, and that's part of our outreach. It's basically to make sure that SEDU and the workforce development boards are aware of the Native people in the state and where you're located, and make sure that they are diligent in their own outreach efforts to make sure that their services are being made aware to your tribal members. In other words, to make sure that your tribal members and community members are getting the services they need in regards to employment and workforce. So what I've been doing is going to different workforce development boards. I've spoken to the one here in the Midlands. I've spoken to the one, what's called Trident, which is in the Charleston metro area. And I have some others that are upcoming later in the spring and the summer for the upstate. And again, it's basically, you know, I tell them where you're located, what CMA does, the Native Advisory Council, and encourage them to directly contact you guys for further outreach and to find out exactly what your individual needs are. Because I always tell them I cannot speak for the individual, tribal communities, because everyone's different. But I can give them a general overview and introduce them. And believe it or not, many of those individuals aren't aware of your presence around the state. So you guys are there and are in need of their services regarding employment and workforce. I also have been giving, along that same note, a college presentation to at various universities in either a history or a poli-sci class that deals with Native American issues. And again, it's pretty much the same thing, just sort of a cultural awareness to make sure the college students are aware in those classes are aware of your presence, how CMA works with you guys, how we help locate resources for you, and as far as the overall, governmental structure and how the Native people interact with South Carolina state government.
Jeremy, I
yes.
do have a question for you.
Yeah, Lisa.
When you were in the Trident, can you tell me when you went down to speak to Trident about the local groups in the area?
This was about a month ago. I know it was back in February. I'd have to look at my calendar specifically. Mid-February, I think. And that was through the Berkeley Charleston Council of Governments that's located in North.
So how do we reach out to them? So you've already gone and let them know about us and everything.
Right.
So did you share contact information, or is there a way to reach out to them and get their contact information?
Yeah, I can send that to you guys individually. Now, what I did is, on our CMA Native American fact sheet, it lists all of you guys and your contact info, right? So I gave that to everyone in attendance that day, to all the workforce development boards that I go to. That's what I say. If I encourage them to contact you directly for follow-up, for additional, outreach. And I said, this is how you do it. So Chief Collins, your name is listed there along with everybody else, and how to
Okay.
reach. So everybody who was present that day, either in person and or via Zoom, workforce development and their partners, which that includes other state agencies that provide services, were there. So everybody got a copy of that CMA Native American fact sheet with your contact information. But again, on the flip side, I encourage you to follow up and contact them. And, maybe they are interested in coming to one of your local events too, and maybe coming in at providing a speaker to your tribal community. And that's what I I just kind of open the door.
Okay, I do have a suggestion. If you ever come in the area of Trident or Charleston area, and if we know in advance, maybe we can accompany you to whatever you're doing and maybe have more of a face-to-face, hands-on when you're there.
Okay, I can suggest that too. Again, I knock on their door and they tell me whether I'm, coming in or not. And if they're willing,
Right.
both of us come in, I have no problem with that.
You think they would not be willing for both of us to come in?
I would think not. I would hope not.
Okay.
Certainly. But I mean, because again, I can say, well, I'm not here to speak on behalf of, I'm here to make you aware of the
Right.
local. And therefore we have Chief Collins who can represent and so forth and so on. So
I just think if they have specific questions, you're not going to be able to answer based on your knowledge of what's going on in our communities. So if we were there, we can help assist with any of those more specific questions.
yeah, well, to be honest, these are often very brief meetings because I was one of two speakers that day. So they allotted me 20 minutes, 25 minutes, which if you wanted your message sent out, I would think a follow-up, more in-depth presentation would be more effective. And that's why, in the initial meeting, I go in, open the door, so to speak, make them aware, and then for in-depth, information or questions from the local needs, that's where you come in as a follow-up or have them come follow up with you. Because many times I'm one of 2 or 3 people on an agenda.
Yeah, but we don't meet frequently. We meet every quarter when we meet with CMA. So you've been out there a month ago. So it's been a month that's passed that we could have been doing this follow-up. So maybe when you do meet with them and, it might have some kind of impact on our community, maybe if we can get a heads up and say, I just met with these people, this is what I discussed, and maybe the door's already open at that point for us to have an option to reach back out to them and set something up quickly.
Okay, do noted. All right. Hopefully they will follow up and encourage, to reach out. If they're not doing it, then by all means, then you certainly are, are welcome to, follow up with them as well. And if you need their contact information on who to reach, I can provide that to you.
I would love for you to provide that information.
Okay, I can do that. Let me make a note for you right now.
Jerry, Dr. DaCosta has entered the meeting.
Oh, thank you, Sharice. Okay, thank you. Dr. DaCosta, do you want me to continue with my programmatic update, or would you like to jump in here now?
No, good morning. Go ahead with what you're doing, Jerry, and I can, chime in as we go. Good
Okay.
morning, everybody.
Okay, thank you.
Good
Dr.
morning.
The last thing I had as far as my programmatic update is actually, Brenton, since you are present, correct? I think I see your name there.
Yes, I'm here.
Okay, this is Brenton Brown. He's CMA's Chief of Staff. I was going to give you guys a legislative update on both a House and a Senate bill, but since Brenton is our legislative liaison and he is present, I will let him, Brenton, if you're comfortable doing that, I'll let you do that at this point.
Yes, no problem at all. And good morning, everyone. And I want to talk about two pieces of legislation, and please forgive me, I do not have the bill numbers in front of me. However, after I finish speaking, what I will do is I will place this information in the chat box for everybody. But there are two bills that have been presented in the General Assembly that particularly affect Native American communities. One is a bill that has been filed by Senator Hutto. That bill is for the use of game parts and other, I'm sorry, I'm trying to pull this up right now as I'm speaking. Well, let me talk about the bill that was filed in the House. The bill that was filed in the House was filed by Representatives Jermaine Johnson and Richie Yao. That is to change, to make Indigenous Peoples Day a holiday here in the state of South Carolina. I called the General Assembly where the committee, where it's located. I've asked them what the status of it is. And at this particular point in time, that bill has not been assigned to a subcommittee. And so it has not had a hearing yet. And so if that changes, I'll be sure to alert Jerry so that everyone can be made aware of that. The second kind of more substantive bill is what is called Senate Bill 590. That particular bill does the following. It relates to the duration of hunting and fishing licenses, permits, and tags for recreational purposes for Native American Indian licenses. And it also kind of takes what's in place for the Catawba, but extends it out to our state tribes to provide a license for someone who has proof of membership as a member of a recognized Native American tribe or group. And so what they're trying to do is extend lifetime permits. They're trying to update the term Native American within the code of laws so that it extends out further. And then it also relates to the use of wild turkey feathers in art and for sale or of traditional Native American Indian artists and their crafts. I spoke with the Senate committee that is dealing with that. That one at this point in time is not up for debate when it comes to a subcommittee. It's in the Senate's Committee on Fish, Game, and Forestry. But I have contacted them, and I also contacted the House where the other bill was filed. And I'll keep note of that, and I'll definitely let people know if those particular bills come up for a subcommittee hearing. I'll also place this information in the chat box along with my contact information if you have any questions. Thank you, Jerry.
Okay, thank you, Brent. I want to follow up with that. Either one of those bills, does either one of those relate to the state surplus store, like the changing of definition for Native American, right? Is that surplus?
Yeah, so this particular bill, neither of the bills deal with surplus. With state surplus, they have kind of their own designation that's kind of run through the Department of Administration, but they also administer the federal surplus program, which has its own separate requirements. For that one, you, if I remember correctly, it's been a while since I looked back at it. I think it extended to Native Americans that lived, as they termed it, on a reservation, which we, for all intents and purposes, we don't have here in the state of South Carolina because the state has not designated reservations. And so the federal surplus program does not look like it can expand beyond where it is currently. But the other bill that I talked about, S590, does not talk about the state surplus program at all.
Okay, thank you. I wasn't sure if it did or didn't. I was just wanting to get clarification on that.
You're welcome. And if I could also do this as well, just kind of very quickly, we've been working with the Department of Administration and the Office of Regulatory Staff on an effort called Get Connected SC. That effort is to essentially make sure that broadband is extended into all of the rural areas of South Carolina and the areas that are underserved and unserved when it comes to internet needs. And so that was rolled out about 3 weeks ago. There was a press conference with Governor McMaster and Congressman Clyburn. They have started to do road shows. They're doing 26 across the state. And I do know that they have also connected with some of our tribal leaders to go to at least 2 powwows. And so what I'll also do is place more information about that. What Dr. Fenton has placed those links in the chat box. And if you have any questions on that, or if you would like to make sure that your group is represented, please let us know. We're trying to make sure that all of our minority and rural communities are represented on the survey. Thank you, Jerry.
Thank you, Brent. Okay. Dr. DaCosta, would you like to jump in at this point before I introduce our guest speaker, or?
I want you to keep going.
Okay, all right. Well, our first guest speaker is Jan. Am I saying that correctly? Okay. Nehru?
Yes,
Nehru.
it's Jan Nehru, yes.
Okay. Well, he's with another state agency, the South Carolina Department of Drug and Alcohol Abuse Services, and DAODAS, as we call it in state government. And as many of you know, nationwide, drug and substance abuse is an issue in many Native communities. And it may or not be, in your particular community in South Carolina, but if it is, and you would like for your local tribal community members to receive benefits and, receive services from DAODAS in addressing this potential issue, then we're going to hear more about that now from Jan, and he's going to provide us some information on DAODAS. Go ahead, Jan.
Thank you, Jerry. I appreciate it. Again, my name is Jan Nehru, and I work here at DAODAS. I'm going to share my screen so that you can see my slides. All right, I need to share this side, and then I need to make this the presentation. Okay. Let's see. Am I sharing the right? There we go. Okay. And I can't see you, but can you see my screen where it just has our front page on the slides?
Yes, we can.
Okay.
Yes,
perfect.
you're able to see it.
Thank you. I occasionally share the note side and then have to get corrected, so I appreciate it. Just real quick, as I'm going through, so I'm going to give an overview. So I'm going to touch a lot of topics very quickly. As I said, I can't see the participants on the Zoom piece because all I can see is this. But if you guys have questions, or if you want me to sort of dig into a particular piece, that please interrupt me. Like I said, I can't see the hands raised, but please just come off mute and ask me a question. This, I like for our presentations to be interactive if possible, but I'm going to try to move through a good bit of information just to give you an idea of who we are, what we do, the services that we offer, and what is available to every South Carolinian. Real quick, I want to talk a little bit about what substance use disorder treatment looks like in South Carolina. So the treatment landscape has changed tremendously over the last few years. We've made big leaps and bounds probably just in the last 5 years, but over the last 20 years, we've been making a great deal of changes. And one of those is to really take a more holistic approach. It used to be the days of put somebody in the hospital for 28 days, lock them down, and then send them out and say, here you go. Today, we try to really make an effort to meet people where they are, where they're at, be able to involve them in their treatment process. You know, it used to be very much where a doctor told you what you were going to do. Now it's, hey, tell me where you're at. Tell me what your life looks like. Tell me what you think might be beneficial for you, and be involved in the process. When we talk about the difference between treatment and recovery, we traditionally think of treatment being sort of an acute response to a situation, and then recovery being the ongoing process. We have always thought of that in this way. You go to treatment, then you enter in recovery. But we've really changed our thought process about that. And we believe that recovery begins the first day you start treatment, because you are beginning to live a different life. You're beginning to change your behaviors. You're beginning to change how you do what you do, and where you do it. So we have really sort of integrated the two of them together. We talk, treatment still is specifically about a clinical aspect, but recovery walks alongside of it from day one. There are a number of different types of treatment available. I just want to briefly touch on those. So there's inpatient and outpatient. You know, inpatient is, again, what we've seen in the movies, what we think of. Somebody's in a locked facility, or maybe not a locked facility, but they're on site. They don't leave the site, and they are in an intensive group setting all day long. We have outpatient. So we have county agencies here across the state. We have 31 county agencies that serve all 46 counties, and they provide outpatient services. There's also a number of private facilities that provide outpatient services in a situation like that, where you would come to a facility for that day, receive services, and then go back home. Medication assisted treatment and recovery. So that involves Vivitrol, naltrexone, buprenorphine, Sublocade, methadone. We'll talk a little bit about that in a second. We have a number of faith-based settings that bring a person's culture, bring a person's identity, bring a person's behaviors into how they receive the treatment. There is also individual counseling, group counseling, and then there are some community-based recovery organizations. We'll talk a little bit about that, where they provide varying degrees of some recovery. Some actually provide some treatment services there, as well as some counseling. And the primary thing to remember is everything that we support is evidence-based. All right. So when someone is seeking treatment, it's important to remember that different substances have different treatment approaches, as well as different individuals have different approach. But the substance that the person is using oftentimes will dictate at least the initial approach. If a person is using or abusing opioids, oftentimes there'll be a detox process, there'll be a social detox process, there'll be an outpatient services. Alcohol, there's oftentimes an inpatient detox. Contrary to popular belief, alcohol and benzos are the only two withdrawals that have the potential to actually be lethal from the withdrawals themselves. People can die in withdrawals from other substances, but it's usually something else related. But from an alcohol withdrawal or benzodiazepine withdrawal, that's where the withdrawal itself can actually be lethal. Stimulants, methamphetamine, cocaine, again, outpatient social detox. Benzodiazepines, like we mentioned, that would be an inpatient detox. Cannabis, outpatient social detox. And then there are sort of this other group that we call synthetics, and that encompasses more of your MDMA, ecstasy, those kind of things. And again, outpatient social detox. So the point of that is to say that the substances themselves that the person is using and abusing may dictate how treatment is approached. There are also different treatment expectations. It's really important to recognize, and we believe this, and this is messaging that we work on daily, but it's important to recognize that people have different treatment experiences, and people have different treatment expectations. People seek treatment in different ways, and people receive treatment in different ways. And whether it's ethnic, ethnicity, whether it's race, whether it's where you're born, your socioeconomic status, your sexual identity, even your language, whether you speak one language or another, and then also if you have a strong faith in either with your culture, with your religion. People seek treatment differently, and I think we've spent a long time assuming everything was one size fits all, and that's not true, and that's not been our experience. And we unfortunately took a little while longer than we anticipated to learn from that, but we have, and we're trying to make sure that we can approach that in a way that is culturally responsible. Again, people seek treatment in different ways, and it's based on, again, like the things we just talked about, but we are really, really trying to offer a wide variety of what treatment can look like based upon an individual's needs. And we're trying to remember there's different pathways to treatment, different pathways to recovery. And it's important to honor that, and to honor the individual's wishes as well. We mentioned medication-assisted treatment and recovery. I just want to briefly touch on that. And that's exactly what it sounds like. It's a treatment or recovery that utilizes medication to help somebody. There's a lot of misconceptions about that out there right now. And one of the things that I like to liken it to is diabetes. If an individual has diabetes and they go to the doctor, then one of the things that's going to happen is they're probably going to say, hey, you need to take some medication and you need to make some lifestyle changes. This is no different than that. This is, we're asking you to, if you want to move into a sustained recovery phase, you're going to need to change some behaviors, and this medication may be helpful for you. And if it is, then this is what we think would help assist you get on down that road. Again, living, I use the diabetes analogy quite a bit because I think that's more palatable for some people. And it's really a combination effect. It's also kind of like cholesterol. If you have high cholesterol, you might get prescribed Lipitor, and your doctor's probably going to ask you to make some food changes, maybe some exercise changes. We're talking essentially about a very similar thing. We're asking for behavior changes, and we're asking you, hey, here's some medication that might help you get down the road. Okay. Now there are some some challenges with that. Vivitrol is a monthly injectable that helps reduce cravings. It's extremely expensive. Naltrexone is the oral medication version of that. It's a daily pill. Methadone is used for opioid treatment, opioid use disorder treatment. One of the limitations for that is you've got to show up at a facility daily for your medication unless you've been stable up to 3 years. Buprenorphine is another medication for opioid use disorder. Its price is getting better, but its price can be a barrier, and there are also some diversion concerns. And then Sublocade would be an injectable version of buprenorphine, and its price is a barrier for some people. So here's what I kind of want to talk about predominantly is stigma. Stigma is probably one of the biggest barriers that we face today in helping people receive services. We've got people who have stigma from even having a substance use disorder. They're looked on by their family, by their neighborhood, by their environment, by their job. There's still a great deal of misinformation, of a lack of understanding, and it's like I said, it's probably one of the biggest barriers that we face whenever we try to implement a new process or a new program for people. There's a lot of what we refer to as NIMBY, not in my backyard. I'm trying to remember where it was. I was looking at a Facebook page, I guess it was maybe 2 months ago, and I can't remember which town it was, but it's some Metro Columbia. And somebody was talking about there was a piece of land cleared, and they were saying, hey, what's being built there? And people were making jokes about what was being built there, and somebody mentioned a methadone clinic, and the comments on there were kind of heartbreaking. The comments about, you know, the people who would need the services, the comments about what would happen to the neighborhood. So if there was any question that stigma is alive and well, that answered that question for me. Now, again, we talked a little bit about that there's not this one size fits all anymore. And again, I want to make sure that I impress this upon everybody, that the idea of treatment and recovery being separate, not being concurrent versus being consecutive versus concurrent, is something that we are trying to get away from. We're trying to make sure that people understand that these are concurrent processes, and these begin at the same time. So we talked a little bit about treatment. We talked a little bit about recovery. So we have a couple other services that we offer here. And one of those is prevention. Hold on, my slide didn't go. There we go. So prevention is exactly what it sounds like. It's the opportunity to try to prevent the excessive use and misuse of illicit drugs and alcohol. Every county agency that we have, and I have a little map at the end to show where the county agencies are, because like I said, we have 31 that serve all 46 counties. So obviously some serve multiple counties. But every county agency has a prevention department, and their focus is to help a wide variety of the population. It's focused not a lot of times people will think prevention of school age children, and that's a very large part, because we believe the earlier that we can intervene in somebody's life and the earlier that information can be provided, the more likely that it is to be absorbed. We have a program, and I'll talk about it in a couple slides. It's actually it's a program in response to if somebody would have a DUI, but the curriculum itself is called Prime for Life. And an individual that I know had gone through that program, and I believe the statement that they made was, you know, if I had heard this in high school or junior high, I'm not saying I wouldn't have made some of the same choices that I made, but I would have had some more information. And this is, you know, a person who's been around treatment and recovery for some time and was in their mid 40s when they went through this process. But they talked about how valuable this information would have been in an early age. So I don't think we can underscore the value of prevention. All prevention is going to be evidence-based curriculum, and it's a standardized process usually. So for instance, there are some education programs that, you know, like Botvin's Life Skills, Strengthening Families, things like that. These are all evidence-based curriculums. They are standardized. People are trained in them to provide them in the way that is consistent with the fidelity for the program itself. We have versions that are tailored to children, to young adults, and even to seniors. And we, again, as I mentioned earlier, about how we are trying to make sure that we truly take a holistic approach to treatment and recovery, as well as taking people's culture into account with services. We're doing the same thing with prevention. So we there is a focus on making sure that everything that is presented is not only accurate, culturally responsible, I guess is the best word, and relevant. Because, you know, I think we all understand that if something is presented in a way that is in contrast to our particular culture, it's very hard to hear. So we're trying to make sure that we are responsible in that respect. There are different types of prevention. There's community-based prevention. You might see people at a health fair, a community engagement, an outreach event. We always have a booth at the South Carolina State Fair, and it's just kind of a visual way. And we talk about prevention there. We talk about a little bit of treatment and recovery. We have some information available. We also talk about some intervention strategies. We have school-based prevention. So these are individuals who will actually work within the school system, and they'll work with school-age children, junior high, high school, sometimes middle school, And they'll be working with the counselors to help identify risk, to help provide services for when a student has demonstrated that they are at risk. I know there's one county in the upstate where I think it was 2 years ago or 3 years ago, I'm trying to remember now, where it was a high school, or it is a high school, excuse me, where if a student was caught with illicit drugs or alcohol on their person or in their locker, they were expelled. Also, the local county agency had worked with the school system through their prevention director and developed a program now to where instead of being expelled, they can be referred to services and they can stay in school. And I think that's a very tangible way that that we can interact with the schools and with other systems like that, where we can really try to impact an individual's life. Because if you get expelled from a school, especially in some rural communities, if you get expelled from a school, the other school might be 25 miles away. And depending upon limitations with transportation and things like that, you may be in a really unworkable predicament. So this was a way to sort of alleviate some of that and provide safety to the school and also some help to the individual. Also do drug take back days. There are 2 national drug take back days that we participate in, but our agencies have what we call drug take back boxes at many places. I believe most sheriff's offices have them, but a lot of CVS's and Walgreens have them as well. And then some are also strategically placed throughout the community. When I talk about the resources at the end, I'll be able to, I can show you where you can find lists of all these types of resources. In line with prevention, we have intervention. This is what, when you hear people talk about Narcan and overdose reversals, this is what we refer to as intervention. This is where we actually intervene on somebody who is doing something. So for instance, if a person has overdosed on opioids, Narcan is a way to reverse the effects of that overdose for a short period of time. And while we're talking about that, let me just mention this. There are still some misconceptions about that as well. Some people think, well, if an individual is experiencing an overdose and you provide them with Narcan, once you get them the Narcan and they come out of it, then they're okay. That's not the case. So the problem is, what that does is that reverses the symptoms temporarily, that restores the breathing, that brings back some level of consciousness, but a person can slip right back into that. So that's why with our Narcan training, we always talk about how it's important to not only give the Narcan, but to immediately call 911, because you're trying to get them stable enough until EMS shows up. Also, there's some confusion about if you were to give somebody Narcan that wasn't having an overdose, but you thought was, could it hurt them? And that's one of the messaging that we always try to get out. No, it will not hurt them. If you think somebody's experiencing an overdose and they're not, and you give them Narcan, there's no ill effect to that. ADSAP, that is what I was talking about earlier. It's our response here in South Carolina if an individual gets a DUI. Or there's a couple different ones. So there's a DUI, DUAC, driving unlawful alcohol content, and then there's or DUI drugs. You get referred to the ADSAP program, and what that is a curriculum, that Prime for Life curriculum, where it provides information to an individual. It gives them some of the science behind addiction. It provides them with an understanding of or an attempted understanding of their behavior. It provides them with a way to maybe look at what they're doing a bit differently. And then depending upon the severity of the individual's substance use disorder, if they have a substance use disorder, they may not. If they do have a substance use disorder, then they'll also be referred to a higher level of care. If they don't, if it's not determined that they do, then they'll just receive the Prime for Life curriculum, and they'll hopefully receive enough education, enough information to be able to make higher quality, lower risk decisions going forward. So just talk a little bit about what the landscape looks like here in South Carolina. As I mentioned, we have 31 county authorities that provide treatment, prevention, intervention, and recovery support services. We cover all 46 counties. So it's not like, for instance, we have the Alpha Center, which is Kershaw, Arlene, Chesterfield. It's not like there's one building for all three counties. They'll have a building in all three counties. It's just the one organization would serve those three counties. So there'll be an actual office in all 46 counties. We have 4 detox facilities here that we support: Greenville, York, Charleston, and Richland. We have 8 different inpatient options. Some of those are supported by us. Some of those are private. We have 28 what are called opioid treatment providers, an OTP. That's what somebody would traditionally think of as a methadone clinic. However, one of the advances that we've been working towards and have implemented this year is that now if you were to go to one of these opioid treatment providers, you have the option of methadone, or they also are able to prescribe you buprenorphine depending upon whatever is more appropriate for you and what you're going through. And again, this kind of falls in line with what we talked about in the very beginning about bringing the person's choices and lifestyles into the decision-making process, because there are pros and cons for both, and this gives people options. We have 13 what we call recovery community organizations across the state, and those are community organizations that are based based on recovery support services. So that could be a whole range of things. That could be, you might provide mutual aid meetings or a spot for mutual aid meetings. You might provide job skills training, how to write a resume. You might provide childcare for individuals who, let's say they're going out looking for a job and they need somebody to watch their child while they go on interviews. Often we'll have things like computer set up where people can come in and use them if they don't have a computer, or just space to meet when things get challenging. Like I said, so we have 13 of those across the state with, and they serve 20 different locations. We have hundreds of what we call an office-based opioid treatment provider, OBOT, because we love our acronyms. And those are doctor's offices where an individual can be prescribed medication for an opioid use disorder. And we have a number of culturally specific services. One thing I wanted to highlight is the Catawba Nations work and effort, and we have partnered with them over the last couple of years in various ways. But they have recently opened up their behavioral health division, or expanded their behavioral health division, excuse me, and really are able to provide continuum services across the substance use disorder field. We are currently, we provide, or excuse me, we promote a yearly event called Recovery on the River, and it's here in West Columbia. And last year, the Catawba came down and they opened it up with a friendship dance, and then they had individuals. We have like a tent and a table where people can set up, and they were here and they were doing smudging, and they had a drum circle, and they were able to educate people on their culture, and they will be down this year as well, opening up with a friendship dance. We're not sure if they'll have a table or not, but they'll be back here in May, and that happens each May. So we are very excited to be able to welcome them back down here for that. We also have a few, or we have 2, excuse me, faith-based RCOs. We talked about that, recovery community organization. So these 2, Trinity Recovery, which is tied to Lutheran Church, and then Recovery All SC, which is tied to the Oak Grove Baptist Church. Those are 2 organizations, and they cover 6 counties. So these are the first of their kind in South Carolina. We didn't have faith-based RCOs 2 years ago. We brought them, we put out a request for funding and helped these 2 organizations open up last year. So now we have people who may not traditionally walk into a quote unquote treatment setting, but they might go to the church, and they might go to the pastor, they might go to the reverend and ask for some help. So this is a way for to get more culturally appropriate help. And one of the things that Trinity Recovery focuses on is going out to other congregations, and it's a training called I forgot, I think it's recovery informed congregations. So they go out and they provide training to other congregations on that, and it's helping people to sort of understand what a substance use sort of looks like, how best to help an individual who has one, and how to, where to refer them for other services. And we're also working with CARD, which is the Center on African American Recovery and Development. And we are helping them with some initiatives here in the Midlands. A lot of these organizations use what we call peer support specialists, and a peer support specialist is somebody who has a lived experience but has been also trained and is able to help individuals either new in recovery or contemplating recovery, in treatment, out of treatment, help them sort of navigate the landscape. And one of the big things that we talk about a peer support specialist being is a advocate for the patient, because so often the patient feels like they have no voice. The individual walking into a treatment facility for the first time or into recovery for the first time, there's a great deal of shame. There's a great deal of they've been beat down for a long time, and they feel as though no one will listen to them, and they feel as though they don't have the ability to speak up, and a peer support specialist is able to be there and advocate for them. So I just wanted to show you a little bit about our services. So these are our 31 county alcohol and drug abuse authorities. You see they spread across all the state. I have a little map for that here in a second. But this is what looks like. These are what our OBOTs look like, our office-based opioid treatment providers, as well as our OTPs, our opioid treatment providers. So the opioid treatment providers, again, would be a nonprofit, a profit, what we would traditionally think of as a methadone clinic. So I just like to give this slide to show the numbers and to show the reach and to show that there are services available in each county. These are the locations of the recovery community organizations. Like I said, there's 13 of them, but they cover 20 different locations. 4 have multiple county coverage. This is what it looks like for our county authorities. So you'll see we've got a number that cover multiple locations. You have Calhoun, Orangeburg, and Bamberg. That's covered by Tri-County. Down there in Allendale, Hampton, and Jasper, again, that's covered by New Life. But one of the things I want to make sure that I mention again and reiterate is it's not like there's one location and then they serve the other counties. There is a physical location in each county throughout South Carolina. Then for somebody who is looking for some of our resources, there's a couple different ways to do it. Our website, Daedos's website, offers a great deal of navigation for resources. We list treatment providers, we list OTPs, we list, I'm trying to think, we don't list that, so but we also link up to other resource sites, and one of those is this one on the bottom called the Embrace Recovery website, and that will provide you with listings for recovery community organizations, mutual aid meetings, some FQHCs, federally qualified health centers, excuse me. We get caught up in our acronyms, and sometimes I forget to explain them. You can also reach out to one of your local RCOs. So one of the things about a local RCO is they are sort of the expert in that location for helping people navigate treatment, recovery, and prevention services, intervention services. So if and because everything is very, very local, and I think sometimes we forget that and we think of the state, but what's appropriate in Dillon County may not be appropriate in Beaufort County or in Richland County. So I think it behooves people to go to the local experts because you know your landscape better than anybody. And the other thing you can do is you can call us. We answer the phones all day long. We have a number of different people who will be able to assist with answering your questions. And if we don't have the answer to your question, we can certainly direct you to the person who probably would. And like I said, we man the phones all day. We take the calls and we do our best to help people sort of navigate and walk through what their needs are. So that is what I have as an overview for the services that we provide.
Thank you very much, Jan. That was very important and informative. I'm sure many of our tribal leaders here were probably not even aware of DEODIS in the state. And is it okay if I share your email with them?
Absolutely.
If they wanted to follow up for additional information?
Absolutely.
And you can maybe provide some more detailed contact info, any questions that they may have regarding, how they're sponsored. I know when I worked for Voc Rehab, that a lot of times we at Voc Rehab refer people to DEODIS, vice versa, and Voc Rehab would pay for the treatment plant, services offered via DEODIS. So I'll put your email contact information in the chat box for everyone to have. Okay. And again, thank you for coming today and presenting to us.
Thank you for having me. I appreciate it.
I'm sorry, I didn't realize my camera was off. Okay, yeah, here I am. Again, thank you again. I'm gonna give Jan's email contact information in the chat box if you have any follow-ups a question you'd like to follow up with him on. And at this time, I will introduce
It looks like Dexter wants to say something.
Oh, I'm sorry, Dr. DaCosta, go ahead. Yes.
Dexter, did you have a comment?
No, ma'am. I've been knocked off 3 times. I was just trying to get back on.
Got it. Okay.
Oh,
all right.
Okay. Well, I'm glad you could join us, Dexter. I'm glad. Good to see you. Okay, Dr. DaCosta, would you like me to continue with Cheryl, or would you like to?
Yes, please. Yes, we want to go ahead and let Cheryl present.
Okay, Cheryl. It's the ball's in your court, so take it away.
Okay, am I waiting for the presentation to be uploaded, or am I running it myself?
Does she have shared? There it is.
There it is. We see your
okay. Okay. All right. Thank you for your patience with me on this. I'm just going to get started. So my name is Cheryl Kale. I'm the Vice Chief of the Waccamaw Indian People and the chairperson for Idle No More South Carolina, which is a committee under the South Carolina Indian Affairs Commission. So while advocating for environmental justice, I learned that my son's testicular cancer was likely linked to toxic chemicals in our water. Following that discovery, I joined the National PFAS Contamination Coalition about 4 years ago to help raise awareness and to help demand that the EPA take action to protect people and our environment, and also to hold polluters accountable. So first, next slide. First, I want to begin by offering some science about PFAS. PFAS are a very large class of synthetic chemicals, meaning they are not a part of the natural environment. They're made up of a chain of carbon atoms that are surrounded by fluorine atoms with various numerical values and terminal ends. Very complicated science. Today, there are at least 10,000, although the European Union has identified over 12,000 of these different types of chemicals. Next slide. So when scientists talk about PFAS, they are referring to a class of chemicals, per and polyfluoroalkyl substances. And the difference between per and polyfluoroalkyl substances is the amount of carbon chain atoms that are fluorinated. Perfluorinated chemicals have carbon chain atoms that are completely fluorinated, whereas polyfluorinated chemicals will have at least one carbon atom chain that is not fully fluorinated. And a lot of that, unless you took chemistry, doesn't mean much. And to be quite honest with you, it didn't mean much to me until it impacted my own family. PFAS, PFOS, refers to perfluorooctane sulfonate, and PFOA refers to perfluorooctanoic acid. And these are the two most commonly known PFAS chemicals, with PFOA also referred to as C8 because of the 8 chain. Next slide. So because of the nearly infinite number of variations, there are thousands of these chemicals in use today in industrial processes and consumer products. And what creates the threat to human health and the environment is that this class of chemicals are highly mobile. So they transport easily via air and water, and some are, excuse me, known to be persistent, bioaccumulative, and toxic at low levels. Production of these chemicals create numerous routes of exposure to the environment and to people. And as you can see in the diagram, the chemicals are released in the air from the producers, which then goes into the atmosphere and mixes with rainfall. They're also released into the water through direct discharge into streams and rivers. And the waste from the production of these chemicals are sent to wastewater treatment facilities as well. And many of them produce what's called a biosolid or sludge that is then applied to numerous farms and crops, thereby getting into our food at times and also back into the water. Through the use of firefighting foam and waste to landfills, they leach into rivers and streams and also the groundwater that is below our waterways. And if you think of where you get your water from, generally it's called surface water. If the surface water or the table becomes low, then they draw from the groundwater below our waterways. And lastly, these are used in many consumer products in our homes, which then get disposed of at landfills and they cycle back to us. So I'm going to pause there and just share a little history on how these forever chemicals came to be so widely used and known, and how without the unwavering dedication of Rob Bilott, we would not even be having this conversation today. So Rob Bilott began his career as an environmental attorney, working for a firm in Ohio that ensured chemical companies complied with cleanup of Superfund sites. This, you can think of Love Canal and some of these other places that had toxic exposure, toxic waste that ended up having to be cleaned up. And he learned that there was like this universe of nasty chemicals, and that there were also rules that responsible parties were to follow. It's pretty simple. You make the mess, you clean it up. So in 1998, Attorney Bilott received a call from a man named Mr. Tennant from Parkersburg, West Virginia, who was concerned about his cows dying. And he attempted to refer Tennant to another attorney, but because it was his grandmother who had shared his information, he decided he better listen to Mr. Tennant's story. Mr. Tennant explained that he had been raising cows on his property that had been in his family for generations on land along the Ohio River in Parkersburg, West Virginia. And he happened to notice that his cows were withering away, their teeth were turning black, they were getting tumors, and they were dying. Fish, deer, birds, and turkey were dying as well. And he believed that the problem was coming from a landfill nearby. So he looked over at the landfill, he followed a pipe, and he could see a white foam coming from a pipe and going into the water where his cows would drink from. So the problem was that DuPont, a chemical company, owned a plant and the landfill that had been in Parkersburg, West Virginia since World War II. DuPont also employed thousands of people in Parkersburg, so most people did not want to get involved. So once Attorney Bilott viewed the pictures and the VHS tapes of the dead cows, yes, it was back in the time of VHS tapes, he visited Parkersburg, he saw the foam coming from the landfill, and he thought, it'll be a fairly easy case to resolve. He'll reach out to them and tell them they need to clean it up. But what he discovered through a review of the records of chemicals being released to the landfill, that there was something missing. He wasn't able to identify what could possibly be causing the deaths of the cows and other animals. So after filing a lawsuit, which is the method that most attorneys use to demand discovery, he demanded DuPont's internal records, and he came across a letter from DuPont to the EPA that talked about a chemical called PFOA. No scientist could tell him what this was, but it indicated that PFOA was being released to the landfill, and there were no records of the chemical ever being reported. The records also showed that PFOA was being produced in massive quantities and had been for decades. The records showed that DuPont began buying the chemical from 3M right after World War II, and it was used in the manufacturing process of creating Teflon. So we all have heard of Teflon because we probably grew up with this wonderful Teflon coated pans and pots and things that, non-stick. This all occurred decades before there was ever an EPA. And during the decades prior to Mr. Tennett's lawsuit, many other variants of PFAS chemicals were developed, but primarily PFOA and PFOS were being used. 3M began selling Scotchgard Protector stain-resistant products in 1956, and between 62 and 67, the FDA approved the use of Teflon cookware and Zonal food packaging products, which provided packaging that was both water and grease resistant and used by many fast food companies. So it was during this time frame that the Department of Defense began using what's called AFFF, aqueous film forming foam, and the Navy and 3M co-invented AFFF after the 1967 fire aboard aircraft carrier USS Forrestal off the coast of Vietnam. 134 sailors died in that fire, and so it seemed like a really great idea to have something that could extinguish fires quickly. Within a few years, it was then began to be used on all aircraft carriers and then soon throughout the military as well as civilian airports and firehouses. Throughout the decades of the 70s and 80s, both 3M and DuPont began studying these chemicals. DuPont had a large group of some of the greatest scientists in the country, of course, because they helped to develop this. They were fascinated with this chemical and they studied it enough to discover that it was stable and persistent. It had a chemical structure that could not be broken down because of the carbon bond, and they began to study what the chemical would do if it got out into the environment. So there is some report that 3M notified them and said, do not let this get into the water. So they were very aware. But through their toxicity testing, they realized that animals, including monkeys, were dropping dead from exposure. So in May 1981, DuPont detected PFOA, it's also called C8, remember, in the blood of 5 of its employees who had recently given birth, and 2 of whose babies had been born with eye-related birth defects. By the 1990s, once 3M discovered that the effects of exposure to humans caused cancers, particularly testicular cancer, they notified DuPont. And in 1998, 3M finally reported to the EPA that low levels of fluorochemicals were widely present in humans based on the test of blood bank samples. So sometimes when you've gone to give blood and you sign the waiver that says your blood can be used for studies, it may be because they're looking for that in your blood. Shortly after Mr. Tennett's lawsuit was filed, DuPont dumped thousands of pounds of C8 into the Ohio River and then released thousands of pounds of C8 into the air. 3M began pushing or phasing out its use of C8 and Scotchgard protection, but eventually they replaced it with something called C4. That's a short chain carbon fluorine bonded PFAS, also known as Genex. Although there were numerous studies conducted by 3M and DuPont, it would be 20 years before the EPA would begin to study the human health impacts of these chemicals. There was a former businessman, Ross Perot, who ran for president as an independent, and he sums it up really well. He said, I come from an environment where if you see a snake, you kill it. But if you see a snake, the first thing you do is go hire a consultant on snakes to study them. Then you get a committee on snakes, and then you discuss it for years. The most likely course of action is nothing. You figure the snake hasn't bitten anybody yet, so you just let him crawl around on the factory floor. Pretty soon you have a whole factory full of snakes. We need to build an environment where the first guy who sees the snake kills it. Unfortunately, that did not happen. Next slide. So how can I be exposed? When you think about exposure to these chemicals, the main route is through your drinking water, contaminated municipal water, or private well water. And you can certainly go on and see that water quality reports are not going to show this chemical because it is non-regulated currently. In other words, it does not have to be tested. It's not required to be reported, but that is currently changing as of 2 days ago. The other ways of exposure, obviously for firefighters, it's use of firefighting foam, but it's also at in this soil and groundwater at places where it's dispersed and then leaches into the soil and water. Biosolid applications for use on farms and crops, and there's numerous farms that spray this stuff called sludge. They use it on crops, mainly crops that are not consumable crops, but that still gets into the crop itself. So that's another way. One of the areas that we have to be concerned with because of so much of our fish industry, we can end up having fish that's contaminated and then consuming that. And if you take the time to look, you'll see in certain areas where there are limitations on fish consumption. One of those areas is the Low Country of Charleston, where it's identified that you should only eat 4 servings of fish a month maximum. So it does impact those that are consuming fish on a regular basis. You can also accidentally swallow this. If any of you have ever eaten dirt, contaminated soil, but also dust particles. Eating food that was packaged in material containing PFAS, and some of the consumer providers are going to PFAS-free packaging material. Consumer products, so your grease-resistant fast food containers, think of pizza boxes, popcorn bags, especially microwave popcorn bags, non-stick cookware. If you have those have been found to release the chemical into your food, even at low temperatures. Stain-resistant coatings, carpets, upholstery, and other fabrics, water-resistant clothing, cleaning products, personal care products, cosmetics, paints, varnishes, and sealants. But our main route of exposure is because we use it so much is through our water, and that can be municipal water or private well water. So it's been identified that most people, go to the next slide. I'm looking at mine. The next slide would be, nope, back one. There we go. Potential health impacts. Most people have been exposed to PFAS, and some PFAS chemicals can accumulate and stay in the body for long periods of time, including a lifetime. It is reported that 99% of all humans on Earth have some level of PFAS in their body. There's also evidence that exposure to certain PFAS can lead to adverse human health effects, including increased risk of kidney, prostate, or testicular cancer, increased cholesterol levels, obesity, interference with the body's natural hormones, decreased fertility, increased miscarriages, developmental effects or delays in children, including low birth weight, accelerated puberty, bone abnormalities, or behavioral changes. A reduced ability for the body's immune system to fight infections and reduce vaccine response. That one came to be known after COVID and the vaccination, release of the vaccination for COVID. Changes in liver enzymes leading to inflammation or damaged cells in the liver. And currently they're looking at the potential for it to cause liver cancer as well. That study is in process right now. An increased risk of high blood pressure or preeclampsia in pregnant women. Next slide. And that would be, yes, thank you. So this is some of the resources for tribal communities, and just keep in mind that some of these were developed for federally recognized tribes that are on reservations, but primarily because of the, tribal fisheries and things such as that, and then farming that's done on reservations, and also because of their own water services that are on that. But it does apply to us as well because of the cultural relevancy to consumption of fish and growth. There are tests that can be done to determine soil composition, Also, obviously, as things are rolling out with this, there's nationwide testing going on for water in our rivers, which is, of course, the source of our drinking water, but also for our tap. And that I participated in a nationwide study. I can't really disclose too much about it because the publication hasn't been released yet, but that will be released hopefully by the end of this month. So what are PFAS and why are they a concern for our health? This just gives you a little bit of a recap from this flyer. And PFAS Reach and PFAS Project Lab are currently the sources for studies and health impacts in communities. What I'm trying to do is bring into this space our indigenous communities and impacts that may be affecting tribal communities. And just based on where you're located, the impact can be greater. And working with some other nonprofits that will be looking at this all throughout the state and doing some more studies, we should be able to have some more information. We're kind of behind the 8 ball in South Carolina because they just started doing the studies last year for our water. Other places, Michigan, New Hampshire, other locations around the country have been very active, and it's been at least a decade for many of them because of exposure. And the next slide, I'm going to tell you a little bit about the regulation, and this is not as much, what to say, we have had not much regulation. Well, currently no regulation in South Carolina, but there are a number of states throughout the country that have set maximum limits. The EPA set a lifetime health advisory limit to 70 parts per trillion in drinking water for PFOS and PFOA. And just to give you an idea, that may not mean anything to you, but 70 parts per trillion in drinking water. The location that I live is within minutes from a place called Market Commons. It was a former Air Force base repurposed to provide for activities, housing. The groundwater at that location is reported at 2,640,000 parts per trillion. So this health advisory limit, which is not a regulated set limit, it was updated last year in June to near non-detect levels by Assistant Administrator Radhika Fox. She announced it for the PFOA, PFOS, and then also PFBS and GenX, which I mentioned earlier. That's that short chain PFAS. And the EPA developed a strategic roadmap in 2021. And that strategic roadmap, they've been doing pretty well. There's a lot of moving parts of this. It changes on almost a daily basis for what's happening because there's so many moving parts. The next slide, I can show you on that, the summary of those 4 health advisories. And this will give you an idea for the lifetime health advisory level. Parts per trillion, PFOA is at 0.004. And this is interim. And they say interim because as soon as they did this, within a few days, DuPont filed a lawsuit against the EPA, pushing back on these health advisory limits. PFOS at 0.02, GenX at 10, and PFBS at 2,000. And the PFBS is a final and GenX 10 is a final for health advisory. 2 days ago, they rolled out a new set of proposed rules for these, to regulate these. And just, if you go to the next slide, please, just to give you an idea of what it looks like in the US. And now this has, again, as of June of last year, this is the last indicator of where you can see the contamination of PFAS identified, but this is again changing pretty often because of the requirements for the PFAS. There are 6 of them that are going to be reported through what's called the Unclassified Contaminant Monitoring Rule, or UCMR. And those tests that are being done, that Rule 5 is requiring that drinking providers, water providers, test the water for a 2-year period from 23, so it just began, to 25, and then report back what their findings are. So as this funding for the Infrastructure Investment Jobs Act and the bipartisan infrastructure bill, within that, there's a lot of funds that can help these water facilities to retrofit their water treatment plants in order to provide clean water, in order to filter out these contaminants.
Cheryl, if
yeah.
I could interrupt you for just a minute here, because of time.
Yeah.
Is it possible for us to bring EPA and DHEC into the room and have a special meeting just to talk about this? Because we're talking water contamination that's harming a whole lot of people. And I don't think we can do it in a session of an advisory board meeting. I think this is something where we need to really get some attention and bring in EPA folks from Washington, D.C., bring DHEC from the state, sit them down at the table, because I'm sure some of these contaminants are in water systems here in South Carolina. And it needs to be acknowledged. We need a lot more education on this so
Yes.
that we can alert the public on what the issue is and be able to get some real answers. Because if we don't have DHEC or EPA at the table while we're discussing it, we're just spinning our wheels. We've got to get those people who can make those decisions do something about it, because water contamination took place. I think they had a situation in Denmark where the
Yes.
pipes were eroded. Kids were being affected. They're learning speech, all of these different things. And EPA had to come in and replace a lot of those water lines. So if I could put a pin in where you are right now, and you get with Jerry and Brenton, we need to do a full meeting on this.
I agree. And I'll just tell you that when I say 2 days ago, 2 days ago, the EPA finally took action. So what I got involved with the National PFAS Contamination Coalition because I saw the problem. And I recognized that it impacted my son and the likelihood that he had testicular cancer from the toxins. That was 4 years ago. I was already working to try to bring tribes and water river keepers together on environmental issues as concerns our water. So this was just a complete diversion off of, okay, this is really a bad thing. I started beating on this drum, and I have been since in South Carolina, and I do see some action, and DHEC is taking some action, but they've been slow to act because the legislature has the power and capacity to change the rules, and DHEC essentially can't move until they do. So
Okay,
that's
then that's
part of-
definitely
Right.
an approach that we can help with. We can
But
get the
the-
legislators involved in the discussion.
Yes, and Dr. DaCosta, so just so you understand, 2 days ago, 3 days ago, our coalition, it's a national coalition, were invited to an embargoed call with the EPA to let us know that the next day, which is 2 days ago on the 14th, they would be announcing new maximum contamination limits. And so it's the first time ever. Okay, the White House released a press release yesterday.
Sure.
So it's taking movement federally. What I'm saying, and I agree with you, is that our state needs education about this. They also
Yes.
need to, and they are doing some things. They are testing. There's sample testing that's been going on that started last year. And I say, okay, better late than never, but it's sample testing. They're continuing their testing. And essentially at this point, almost every river in the state of South Carolina has contamination of PFAS. And that's only on the ones, and I say there are probably at this point 12,000, because as this was kind of getting known, they were changing the structure of the chemical to be used for different purposes. And also because, okay, we'll use this, but what the problem is they don't know what these other chemicals, the health impact from these other chemicals, because it gets rolled out, it gets used, it gets out into the environment. And then we have no idea until something happens,
Right.
whether that's just as bad or worse. And so what we're asking for is a moratorium on producing anymore and on releasing these. And then also for polluters to be held accountable, because now you have this conundrum of states having to fulfill the responsibility of making sure their citizens have clean water, cleaning up the messes. And then who's responsible? Is it Department of Defense, which in part, yes, they're one of the biggest polluters, but is it the manufacturers of the PFAS, which it was claimed that there were no manufacturers of PFAS in the state. Now the EPA, through their analytics, has determined that that's not actually a fact, but there are users. And so in the processing of, let's say, textiles, they're going to use these chemicals, and then that waste gets put into the air, or it gets sent to a wastewater treatment facility to then be made into a biosolid, which just blows my mind that they put this on farms and call it sludge, and that's a good idea. Or it's a spray field, and it's sprayed out in communities that are rural, in communities that have no idea that this is happening around them. And then it gets into their people's wells. In Darlington, the EPA came and shut down the wells of families that were nearby a farm because the levels of PFAS were so high. But this was not until after the young lady that I talked and met with lost 2 of her family members to cancer.
Yeah, and that's why we need to take it to the General Assembly. So if you don't mind, I'm going to ask you to stop right there and
Absolutely.
work with Jerry and Brenton so that we can organize an information and educational meeting, including the members of the General Assembly, DHEC, EPA. We need those folks at the table so that we can address this issue and show the urgency of addressing this issue. More people will die because once you contaminate groundwater, it's hard to clean it up. So
Yeah.
if you would table this right there, I promise you, we will pick this up with some other folks who will definitely be able to move the needle. And we need the General Assembly to move the needle.
Yeah, I would appreciate that, because it's part of what the conservation voters of South Carolina have been working on, but kind of what we call grabbing at the low-hanging fruit to try to do things. But this is a crisis that is reaching out. I mean, I will be speaking next week at a UN side conference webinar. And
if you would send us that information, we'd like to listen in on it if we can.
Okay.
And Jerry, if you would get with Cheryl and Brenton to see how we can organize a meeting within the next few weeks or so that we can have a roundtable discussion about this, whether it's in person or we can take it to another location. We need to invite some legislators there so that we have an opportunity to put it all out on the table so they know the dangers that families are facing by drinking this contaminated water.
And just so you understand, Dr. DaCosta, I have been, the frame up is this, okay? We, in environmental justice, there have been communities of color, Black, Indigenous people of color, have been feeling the brunt of impact from pollution far longer than other communities. And so I've developed a really good relationship with the Environmental Justice Office of the EPA, and trying really hard to amplify the voice of minorities in the state of South Carolina, of the BIPOC communities, because of the disparity for accessing, I mean, like you brought up Denmark, and Denmark itself having such a difficult time with accessing the funds that it needed to
Right.
do something about their problem with their water, and that should not be happening.
Absolutely. I agree with you. And we're definitely going to take this as one of our priorities for CMA. We need to get more people involved in the discussion. So we will table it here, and Brenton or Jerry will contact you and get a list of those people we need to reach out to. We will reach out to the General Assembly and invite those folks. And we're going to set up a date for a roundtable discussion, an in-person roundtable discussion. We're not going to do it by Zoom. We'll find a location because this is serious business. And it's been going on for too long. Too many people today are dying, even children dying of cancer. That's just unheard of. And a lot of it's caused by groundwater contamination and other chemicals that have been placed into the atmosphere.
And now I just want to leave on this note as I head out to determine whether or not I also have cancer
Oh, gosh.
for my appointment. And, you know, regardless of what comes down the road for me, I don't want to see this to be the case for the children that are not born yet. It's been long enough. 50 years is entirely too long to be sitting on something like this. And again, just like Ross Perot said, if somebody had just killed the snake to begin with, we wouldn't be here today.
Absolutely, I agree. And I pray that your results are negative for cancer. And we are definitely going to address this issue.
Thank you, Dr. Costa.
Thank you. Jerry, we have one student who wants about 3 minutes. Can we go ahead and bring the student on? I think we've kept the group long enough this morning.
Yes, it's Nina from USC. If you'd like to say your part regarding repatriation, now's your time.
Sure. Hi, everybody. I just wanted to follow up on the previous meeting. And I'm the NAGPRA assistant at South Carolina Institute for Archaeology and Anthropology. So I am going to keep this really brief. If there are additional questions, I can share my contact information. So first, since the November meeting, we have revived consultation with 14 federally recognized Indian tribes under NAGPRA, and we have published our first 2 notices of inventory completion in the Federal Register. That is the step that has to happen before repatriation can take place. So we're very excited about that. And those, we are about to sign official transfer paperwork to repatriate, to do our first ever repatriations here. So we're really excited. This process is moving. We have also submitted a summary to National NAGPRA, and we are consulting on a claim on the culturally unidentifiable list that we circulated after the last meeting. And that is a really sizable claim for almost 90 individuals and over 2,000 funerary objects. So we have also submitted a consultation and documentation grant to National NAGPRA. And that grant was to continue to pay parts of salary so that I could continue to do this work here at SCIA. So I just wanted to let everybody know that we are moving on repatriation, and we're seeing some steps that we haven't in years past. So we are really encouraged here. If I can answer any questions about specific sites or what any of the steps in this process mean, I'm happy to do that. And I also just wanted to draw everyone's attention to the proposed rule on NAGPRA. So National NAGPRA is proposing to change the Code of Federal Regulations for this law, and they believe that that will be finalized this fall 2023. So there are going to be some changes coming about. None of those changes affect the status of state recognized tribes under NAGPRA. So that's just my quick summary. And again, I'm happy to answer any direct or specific questions, either if there's time for Q&A or I can share my contact information. So thank you.
Thank you so much, Nina. Any questions for Nina? All right, Nina, if you'd put your contact information in the chat, folks will send your email if they do have any additional questions. We have spent a long time in this meeting, and we thank all of you for being a part. sometimes we do have to do this to keep you informed on what's going on. We had some critical issues to be discussed today from Deotis as well as from Cheryl. We are going to follow up, especially with Cheryl and what's going on with the environmental hazards that are facing our tribal communities as well as all of our communities. Because if it's dealing with groundwater or anything that's in the atmosphere, anyone can be impacted by it. So therefore, we're going to continue that discussion. We're going to put together a forum. We want to thank you, Jan, for coming in, talking about what you have to offer. We will have all of their information on our webpage for Deotis, so that if you need any additional information, you can find that information on cma.sc.gov. If we have no other comments or question, we're going to go ahead and end this session. Be on the lookout for an email or some kind of information regarding the forum that we were talking about with DHEC and EPA, because I think that we definitely need to proceed. Alan, Favor, you have a comment?
Yeah, not really pertaining to this, but to everybody on here, we'd like to invite them down to our tribal grounds Saturday. We're having a fire ceremony and we're gonna have a few other things going on. Would like everybody to attend if they could.
All right, very good. That's tomorrow. I mean, day after tomorrow. Saturday. At what time?
Starts at 7:24, but it goes on throughout the day.
7:24 a.m.
Yeah.
Okay.
About time you're wiping the sleep out your eyes.
Okay, very good. Thank you so much. So if you all are up and about, please go to the Waccamaw grounds for the fire ceremony. Very good. Any other comments or question before we end? Thank you all. Okay, go ahead, Cheryl.
Yeah, sorry, just one thing I wanted to make sure that, is it Jan?
Yes.
That you received that message. I did a direct message in the chat, and if you could reach out to
Yes.
me.
I just responded.
Okay. Oh, I see it. Okay. All right. Thank you.
Thank you.
All right, very good. Thank you all for your time and your patience, and we will be in touch very soon.